uh, equine viral equine viral diseases. First is equine herpes virus infection, also known as equine viral pneumonitis. It's caused by equine herpes virus 1 and equine herpes virus 4. Sa epidemiology, lifelong latency of infection caused by herpes virus. Then, kapag mag-apply ng stress or stress is induced, yung virus will reactivate and virus shedding will occur. Pathogenesis. So from respiratory epithelium, which is the portal of entry, it will travel to the lymphatics and to the nervous system and the placenta, which causes the characteristic clinical signs. Sa first clinical sign is fever, then serous nasal discharge, coughing, and also nervous signs such as hind limb weakness can also occur. Then sa lesions, extensive tracheal edema, rhinitis and pneumonitis, multifocal pulmonary necrosis. Then sa necrotizing bronchiolitis sa lesions. Then abortion. Then interstitial pneumonia, hepatic necrosis. And sa diagnosis, immunohistochemistry ng virus, serology, PCR, then supportive treatment, and vaccination, equine rhinomyelitis vaccine. Then next disease is equine influenza. Etiology, equine influenza. Then epidemiology, short incubation period. Equine influenza is highly contagious and characterized by explosive outbreaks. Clinical signs, high fever, serous nasal discharges, dry harsh cough. Then purulent nasal discharge can occur if with secondary bacterial infection. Then broncho-interstitial pneumonia, necrotizing epithelial degeneration sa cilia. Then serology, ELISA, human influenza test kits. Then PCR. Then sa treatment, adequate rest, then bedding. Anti-inflammatory can help to reduce the high fever. Then treatment, antibiotics for secondary bacterial infection and influenza vaccine. Next disease, equine encephalitis caused by arbovirus, commonly arbovirus, but sa Asia is ang common na cause is flavivirus, specifically Japanese encephalitis virus. So epidemiology, JEV or Japanese encephalitis virus is transmitted by colex mosquitoes. Then it is amplified by pigs and Ardidae birds, which serves as amplifying host. Then final host or dead end host nila is horse and humans. Clinical signs, neurologic signs, then fever, lethargy, stupor, and dysphagia, incoordination, staggering, muscle tremors, coma, and death. Lesions, non-suppurative encephalomyelitis. Then diagnosis PCR, treatment, supportive treatment, uh, prevention, Japanese encephalitis vaccine. Equine infectious anemia. Next disease is infectious anemia caused by EIAV virus, a lentivirus of Retroviridae family. Epidemiology, it is transmitted by mechanical transmission of biting flies, tomoxis or stable flies, and tabanus horseflies. So pathogenesis, infection, AAV is known to infect the macrophage, then subsequent na multiplication, then yung body mo produce ng antibodies which forms the antigen-antibody complex. This antigen-antibody complex will be deposited to RBCs causing anemia, platelets causing thrombocytopenia, and kidneys causing glomerulonephritis. So, clinical signs, anorexia, then depression, weakness, abortion can also occur. Then sa jaundice, edema, and petechiation ng mucosa. Then lesions, then diagnosis, test kit, ELISA test kits, then agar gel immunodiffusion or Kagen's test. Control, quarantine. Next disease is EquineViralDisease, also known as equine typhoid, caused by equine arthritis virus, genus virus, family Artiviridae. Carrier stallion or breeding stallion are the natural reservoir of equine arthritis virus. Sa transmission, either horizontal transmission or venereal transmission. Pathogenesis from portal of entry, mucosa, then it will enter the bloodstream, which it is disseminated sa arterioles and venules, then it will cause edema and hemorrhages. So, clinical signs, skin rash or urticaria, hives sa inoculation site ng vector, skin rash, then depression, petechiation ng mucous membranes, swelling of limbs or lymphedema, then swelling of eyes, conjunctivitis, scrotal edema, and abortion. Lesions, necrosis ng tunica media. Sa diagnosis, PCR and ELISA test kits. Then prevention, equine arthritis vaccine. Next disease is equine rabies. Equine rabies is caused by rabies virus, genus Lyssa virus. Epidemiology, horses are known to be likely to contract rabies than dogs. So it is a zoonotic disease and transmitted by through bite of infected animal. So sa pathogenesis, deep inoculation. So for example, yung bite, then it will be the virus will be inoculated sa tissues where the virus will multiply and travel through spinal cord to the brain, then causing paralysis, for example, characterized by head tilt, self-mutilation, aggression, hyperesthesia causing aggression, then ataxia and recumbency. So, sa diagnosis, demonstration ng rabies viral inclusion, also known as negri bodies. Negri bodies. So, diagnosis, fluorescent antibody technique. Then treatment, there's no treatment. All rabies cases are always fatal. Prevention is through rabies vaccine.